Hi everyone. I'm going to be sharing with you my experience of assessing a 3.5-year-old boy. A little background information on this boy and his family. He lives at home with both of his parents and an 18-month-old sibling. His father is 29 years old and is battling stage 4 Hodgkin's lymphoma. He recently underwent a bone marrow transplant as an inpatient and was hospitalized for 4 weeks. And this is the second extended hospital stay for him, and the separation has really been hard on this child and the family as a whole. I used the Ages and Stages questionnaire to assess his growth and fine motor skills, communication skills, his problem-solving skills, and personal social skills. I felt that this questionnaire is a good instrument to use to assess children and their level of development. For me, the only thing that would make it better is maybe to include a couple suggestions for the activities that they would use for children who have scored below the cutoff. Overall, this child did excellent. He excelled in every area. A few things that I feel are noteworthy is under the communication section, when I asked him what his name was, his response was Dr. Joshua Red Power Ranger. His mom had said that he's kind of adopted this alter ego after meeting the physicians that were going to be working with his father during his treatments, and he's taken on this role at home of a superhero physician hybrid who's going to heal his dad. I thought that it was really creative of him to use that name for himself. His mom said that he does use it a lot during play acting. He was able to tell me his name afterwards during the assessment, and he also can write it as well. Under the problem-solving category, I asked him to repeat the series of numbers, and his first response was no. I attempted a second time, and I tried to change up the question to see if maybe I could reword it and get him interested to respond. But the second time, he said, I don't want to. He has been having behavior problems. His mother said that since that he found out his dad was going to be leaving the family again for a few weeks, he's been pretty defiant and difficult. He was having a lot of anxiety and complaining of it being hard to breathe, especially at night or when it was time to go to sleep. She said that he was withdrawn quite a bit before his father left, and while he was gone, he chose not to change out of his pajamas for 2 days. His mother asked him why, and he said, I just don't want to be around people. His mom shared with me that one of her biggest concerns is his withdrawal. He hasn't been making eye contact sometimes with people, new people, as well as family, people that he's known, and she felt that he might be at risk for the autism spectrum disorder. She felt that his social skills were lacking quite a bit, but I couldn't identify any implications of that during my assessment. He is very social. He made eye contact, and he did very well, so I really didn't notice any of that. As a child, she said that he did get a lot of ear infections, and he's recently had some health issues with recurring cyclic vomiting episodes, but partially those can be attributed to his anxiety with the fear of, his father being gone for so long. On his mom's side, there is a very strong family history of cancer and depression. His mother did suffer from severe postpartum depression after he was born, and now with his father's diagnosis, this child is going to have a history of cancer on both sides of the family. So with this child being exposed to the crisis of parental cancer at such a young age, he is already showing implications for behavior changes, mild anxiety, and fear. He has a sensitive personality by nature, and I think with these stressors in his life, he is emotional, but he's also very emotionally aware, which I found to be very mature for a child of his age. His parents have really been attempting to minimize his distress by being open with him, keeping him informed with what's appropriate for his age, and walking him step by step with what to expect with his dad. I've learned that children who are faced with this sort of crisis will most likely have emotions resurface at a later point in time, and I felt that it's very important for this family to continue to support him just as they have been. He is still learning to identify his own emotions and manage his reactions, but I think that the open communication that he has had and the extensive social support circle on both sides of the family is certainly going to help him during this period of his life, as well as adjusting and recognizing the psychological impact that this has had on him so far and the latter effect that it could have on his development. So that concludes my case assessment. I hope you enjoyed listening to my experience. Thank you.